Hello, everyone, and welcome today to another show from the Public Health Talk series. My name is Hamid Bidmus, and I'll be taking over the show today. On today's show, we will be talking about substance abuse among teenagers. Although I'm not a medical doctor, despite what it says below, neither am I a healthcare provider or into healthcare. But I have worked with youth in various communities over the years and do understand how easy it is for them to fall into the temptation of using drugs and getting into substance abuse. On today's show, I do have here with me a familiar face to all of you on the show, and that is Dr. Kafilat Bidmus, who will be helping me to facilitate the discussion. Dr. Kafilat Bidmus is a public health enthusiast and a public health consultant, and she is the founder of Public Health Talks.
Yay.
So, welcome to the show. And for once, Dr. Kafilat, I'll be the one to say that I'm excited to have you here today.
Thank you so much for taking over the show today.
Okay, so let's get started.
Yep.
As a parent, in this topic is a very big of huge concern to a lot of parents, and as parents, we do want to know or understand what are the signs of teenage drug use that we should be looking for in our kids.
Yeah. Unfortunately, substance abuse is one of those challenging public health issues that has affected so many families in different communities around the world. So, and believe it or not, 1 in 5 parents, when they suspect that teenage is on using or abusing substance, for example, do not intervene to actually prevent further usage. And it's quite interesting to understand there are various reasons behind this. Some of the reason is that some parents, they don't really know where to come in from. Some will say that they've gone too far, so, or they don't know how to start the discussion with their children. So, and I mean, there are various signs to look for. I always tell, like, you are the parents, you know your children more than anyone. And it's your job to be able to know if you notice any discrepancies in their behavior, how they used to act. So that's when you step in to help your child, navigate or understand what is it that they're going through. Some of the signs that, to look for include, if, for example, if your child is like a straight A student, for example, and you notice that there's drop in academic performance at school, then you should know that should be a red flag. And also, if your child, usually have interest in stuff and they suddenly lost interest, and it should be a red flag. And that might be other reasons aside from them abusing drugs. It might be other stuff that they're going through that they just, need help. So we as parents need to look for those signs to make sure that, we're on top of them. If we notice those things, then it's our job to intervene and not say that, oh, they've gone too far, or I don't know how to talk about it, because if they go deeper into it, then it becomes a problem for the child and parent later on.
But what about if you didn't have a good communication with your child in the first instance?
Yeah, so that's where that communication is key in every family. Like especially at that age, teenage years, where children are still they're trying to find out who they are as a person. So it's our job to be able to have that channel at home, have that open conversation with our children, and we should always live by examples because when we're telling kids not to abuse drugs and they have easy access to it at home, and then it becomes a problem because we're telling them something and there's prescription drugs, for example, right out of our cabinets where they can use to numb the pain or whatever it is that they're going through. So communication is key, and if that is not there, maybe it's time to actually examine things and improve on that.
Okay, so a lot of times the teens will start using these drugs as in the form of experimenting with it initially, and then in the course of doing that, they become addicted. So, but they start that without realizing the risks involved. How do we navigate or address these concerns?
Yeah, I guess we need to go back to the basic for a minute, in the sense that we need to understand that, when we talk about substance abuse, we're talking about, people utilizing harmful substance, including alcohol and drug, to which most of the time leads to dependency. And we need to understand the difference between, or we have to like make this clear that there's difference between substance abuse and addiction. So if we have, a child that's experimenting with, drugs, for example, it doesn't necessarily mean that they are addicted or they have addiction of some sort. So those are two different things. So with that being said, a lot of kids experiment or abuse substance for different reasons. And, it could be peer pressure, which is like the main thing. And, they want to fit in, they're being bullied at school, or they're in an unstable environment. They just, they're using the drug as a coping mechanism to just, numb the pain, whatever it is that they're going through. And unfortunately, gone are those days where we say, when they get to that teenage years, I have a sit down talk with my child. But unfortunately, we are seeing younger kids as early as 8 years old, experimenting with drugs. So then again, it goes back to what I said earlier, where, communication is key. We should start that discussion early and, create an environment where, our children can come to us and have the discussion with us, anything, because if we don't have that discussion, there's Mr. Google, or, there's somebody else out in the community that can give them the misinformation. So it's better to have that open door policies at home where your kids are free to come to you and confine you. Then you can come up with, a strategy or strategies together in terms of when they approach outside, they will know how to respond. If they are offered drugs or whatever it is, they will know how to respond to the person. So again, it is it's going to be a joint effort between communities and parents, but the bulk of it starts from home. So we have to lay that foundation at home. So this way, to prepare our kids so that when they get to the community or they get outside in society, they will know how to act or how to say no to drugs if they've been offered. Then I was going to add something to that as well. I was going to say that we also need to be careful, because we talk about prescription drugs right out of our cabinets. Kids they can easily take that just out of curiosity, especially like I said, we're seeing 8 years old, as young as 8 years old, doing that. They can easily take that. And also mouthwash is another thing that we've seen over the years that children actually experiment with in terms of getting high on that. And now, in the era of COVID-19, where everybody is saying hand sanitizer, you should have it at home. I mean, it's everywhere. So that's another thing that we've seen in the past that children use to get high. So we have to be vigilant and pay close attention to those things.
So essentially, as we've been saying, communication is very
important. is very important,
and not just waiting until they're teens. Like from the infants.
Those days are long gone, where we say, oh, when they're teenagers, we'll have that talk. I think the earlier the better to have those talks now. So this way we can get out of the way. They are well equipped with proper information from you, and they know that they have that support system at home, somebody they can come to and talk to if anything happens.
Okay, so assuming we do have teens that, for those of our viewers that might have teens that are into this, what would you say are some of the health effects of drug abuse or alcohol abuse or vaping or any form of substance abuse? Yeah,
vaping is, I guess, something that's trending right now, for a lot of teenagers. And, there's a lot of, there is what I'll tell the parent is that, or tell your children that if you have not gone into this, don't do it, because there is the cognitive and behavior, long-term effects of this. So studies have shown that if a child even experiments with it or try it at a young age, there is a good chance that they will become addicted later in life. So it will affect their cognitive abilities, and also behavior, effect is also there. So they start like withdrawing, socially. They loss of appetite. They don't want to be part of a family event, for example. So this kind of thing sort of like it affects them in general, like they can't function even at workplace. They can't fend for themselves because they are under that influence. They can't make proper judgments when if they are in a situation that's harmful to them.
So for parents that are undergoing something like this with their children, and they've discovered that that their teenager in the house is involved in something like this, what can they do?
Yeah, they're help. I mean, I think there's so many groups out there. Get help for that child. Do not ignore the child. Even like you said, they already know, they're aware of it. Get them help. And I know addiction is a disease. So it's important for us to let them know that you're there for them, support them. I mean, right now, virtually places are on lockdown. So but fortunately they have virtual support group where people can take part in or enjoy their service, while in the comfort of their home. And in those kind of this kind of situation, remove anything that would trigger, to help them to sort of like quit, whether it's cold turkey, whatever it is, remove anything, surround them with positivity, let them know that they have that support system, and if they have to go to rehab, check out your local listing and see which it's best suits your family. So there's no shame in getting your child or your family members help if they have substance abuse problem.
Okay. You mentioned lockdown.
Yes.
So as we all know, we're dealing with the current COVID-19, and I must ask, is there any link between COVID-19 and substance abuse?
Yeah, this question has been going around. I guess I've seen that here and there. I guess there's no best way to answer that question because there's no scientific proof. There's a link between the two. So let me just get that. There's no scientific proof. There's link between the two. However, so let me just break it down. So this way it will make sense where my explanation is coming from. So COVID-19 is a disease that affects the lungs, the airways, and the throat. And people that smoke or they use substance, they end up having lung disease. So, I mean, if we put two and two together, and people that have underlying conditions, they're the ones that are most affected or they're vulnerable when it comes to COVID-19. So if someone tests positive, for example, and they have lung disease or compromised lungs, for example, then it's difficult for that person to fight, COVID-19. So that's why I said there is no scientific proof that there's a link between the two. But, however, if you have compromised lungs or you have a lung disease and you have COVID-19, then you don't have healthy lungs. So then it's difficult to fight the disease off. So.
Okay, well, I think that's all I got for you.
Oh, okay.
Yeah, thank you so much for allowing me to take over the show today.
Thank you for taking over the show today.
No problem, no problem. It's a one-time thing.
We'll see about that.
Well, folks, that was Dr. Kafilat Bidmus educating us on substance abuse among teenagers. On that note, I just want to remind you, if you do have any topic that you'd like featured on the show, please IM us, or if you would like to be on the show as well, you can IM at Public Health Talks on Instagram. And do continue to practice preventive measures. We're in the age of COVID-19 after all. And until the next video, stay safe, keep cool. Bye.
Thank you. Bye, guys.